So thank you for inviting me, and I'm very glad to be here. This is a topic that is very close to my heart, and I hope by the end of today's talk, I can infuse all of you with the same passion and awareness I have for creating breast cancer awareness. Can I share my screen then? Yes. One moment. Where did it go? 1 minute. One moment. And can you see the screen or not?
No, ma'am.
Okay. But I did say share screen. Yeah. Now?
Yes, ma'am.
Right.
Ma'am, just a minute, just a moment. I also welcome our managing trustee, Ms. Alaya Kathabala.
Okay. Thank you.
Good morning, everyone.
Good morning, ma'am.
So to begin, hi Alaya, good morning, Madam Mary, and now I can begin the talk. Yes, Aparna, can I go ahead? Yeah.
Yes, ma'am.
Okay. So when we talk about breast cancer, we'll start with the first step, which is what is cancer? Is it an infectious disease? Can it be transmitted by germs, by like typhoid or tuberculosis or COVID or dengue? No. Some cancers, like cervical cancer, yes, we have found that there is a virus, HPV virus, that does do that transmission. But in breast cancer, we find there is no such connection found. What we do know is that the cells are abnormal. I will mostly be speaking in English. If anybody wants me to talk in Gujarat, Hindi, I will convert. So please let me know. Yeah. Okay, so we come back to the cells. Cells or kan jaise kehte hain. The body is made up of millions and billions of cells, and these cells normally function very well, right? We have 1 minute. This goes backward forward. Normal cells. Normal cells, the body is made up of normal cells, and each organ has different specific cells. These cells function regularly, do their work, and as they die, and the body will take care of them with the help of the WBCs and RBCs, WBCs, lymphatics, etc., and the antibodies. They will take care of them and produce new cells in their place. That is the normal progression. What happens in the case of cancer? In the case of cancer, we get abnormal cells. These cells are mutated cells. They have abnormal genetic material. This makes them grow and proliferate, and they do not follow the normal norms of the body. The body has certain mechanisms which help the body to stay, to hold these cancer cells and fight them, right? There are certain genes and genetic material and a lot of other stuff that helps the body to fight. But if the internal environment of the body is not healthy, these cells can multiply and then they grow. Once they start growing, initially they'll be small. It'll be a small group of cells. As they grow in size, they will take over the function, the space, and the food of the normal cells. So initially it will be painless. It'll be nothing. It'll just be a little lump, right? As it grows, it'll cause a pressure on the normal cells. It will cause pressure on nerves. Therefore, it'll cause pain. It will inhibit and harass the working of the normal cells. As it grows further, it can go into the lymphatics. When it goes into the lymphatics, it can block various the drainage methods. So then there will be swellings. When it goes into the blood vessels, it can go to the brain, important organs like the brain, the lung, the liver, the bones, and that's when the problem arises. When we talk about breast cancer, this is exactly where we are. When it is early, it is not causing death. When it comes later, when we find it later, that's when it goes into the important organs where it can cause damage. So it's important to catch it early. Now, why is breast cancer important? Everybody says breast cancer is itna importance kyun dete hai? Why are we giving so much importance to breast cancer? If you look at this, it is the most common cancer among women. And 1 in 4 cases diagnosed with cancer is breast cancer. Most cancer deaths. So let's look at this pie chart. I'm sure all y'all are teachers, so y'all are all very comfortable with pie graphs. The pink is the breast cancer. The gray is a large chunk, but there's a lot of small cancers together. When you look at that big chunk, it's almost like a quarter of the entire circle pie, and that is breast cancer. This is the incidence in the world, right? When we look at the next graph, this is the incidence of breast cancer. We come to the next chart, which tells us the deaths. Deaths due to breast cancer are also the most in the world. So this is important because breast cancer to hua, chalo, koi nahi. But because see, even there is the when we go back to the previous one, we have colorectal cancer, which is another big chunk. But when you look at the deaths due to colorectal cancer, it comes way down. But breast cancer is the topper. It is the topper in number and it's the topper in deaths. So this is why breast cancer, awareness is important, because if we can catch it early, we can fight that incidence, and we can fight the deaths. We cannot fight the incidence because we still don't know what exactly causes breast cancer. With research, what we have achieved is that if picked up in the early stages, 5-year survival is 100%. 8 out of 10 cases are found by women themselves. Therefore, it is important that we should be aware and know how breast cancer presents early and what to do if we can catch it. When we talk about India, every 4 minutes, 1 woman is diagnosed with breast cancer, and every 8 minutes, 1 woman dies due to breast cancer. And the incidence in younger women is rising. Let's look at this pie chart. This is in India in 2020. Look at the percentage. Look at that graph of pink. It is much more than the rest of the world. The incidence of breast cancer in India is much more. So that, and then the deaths due to breast cancer are also more. Because most of these cases we find more in the urban areas than in the rural, definitely. But what we know is that it exists. So we come to the next point, which is can be prevented, which I just told you, it cannot be prevented. We know that there are certain predisposing factors, but what we can do is just catch it early and treat it. Early treatment is the best way to help ourselves. That brings us to who can get breast cancer. We know that women definitely can get breast cancer, right? But 1% of men, there's a chance that they too can get breast cancer because they have breast tissue. So if a man has a problem and it is not resolved with medication, etc., he has to understand that this could be a sign of breast cancer and has to get investigated. The normal age group for incidence for breast cancer has been 50 to 65. That was like older women ko hota hai bhai. It doesn't happen to young women, so let's not bother. No, this is not to be worried about. That's the attitude. But now we are finding the younger women are getting it much more. In India, we see the distribution has increased. The younger age group, 25 to 49 years old, you see 32% of cases, much more. While the older age group definitely has. That's not going away. We are finding increase in the younger age group. In fact, when I was in hospital, I had a young girl next to me, and she was barely 30, daughter's age, and she was undergoing chemo. She had awareness. She had gone to her doctor. She had asked that this is a lump I have, please, can you show me, tell me what to do? And the doctor, see, not all doctors, I'm not criticizing doctors here, but awareness is important for everyone. What we have to know is that we have to know for ourselves. So if you find a problem and you want to get it checked out, you go to your doctor. She went to the doctor said, no, this is not to be worried about, go home. A year later, this increased. She went back, luckily for her, there was another doctor. And this lady said, please, let's get you investigated. And this was definitely cancer. She was in stage 2, 3. And so her life was a pretty difficult stage then. Then you have to, the treatment, everything increases, the risk factors increase, the medications increase. So we have to know and we have to take care of ourselves, and young women too. Besides young women, when we look at it, pregnant and lactating women can get breast cancer too. And this is important because if they do get breast cancer, this is the most common cancer in this group of women. If they do get it, it is usually a rapidly progressing cancer. So it has to be caught early. Mostly in the ones, the lactating ones, the jo doodh pilate hain, right? So what happens, often you get something called a mastitis. Because of the feeding of the baby, sometimes the milk duct gets blocked, and then you get a swelling, and there's an abscess formation kind of thing, swelling vagera hota hai. And then what do? You get it treated. What do you do? First, you do warm massages, a little bit of massage. You keep suckling the baby because the suckling effect will help unblock the milk duct. Suppose the milk duct doesn't get unblocked, the milk might get collected, and that bacteria might come in, an infection, vagera. Then you take antibiotics. After taking antibiotics, after 2-3 weeks, if the whole thing doesn't resolve, it is important to take it forward and get investigated, because this can be a sign of cancer. So going forward, we come to now the topics. There are certain predisposing conditions to breast cancer, right? When we say predisposing conditions, these tend to increase the risk of developing breast cancer. However, not all women who are exposed to these conditions will develop it. For example, now we have the lung cancer and smoking. Not everyone who smokes will get lung cancer, and not everyone who has lung cancer is a smoker. Similarly, we have predisposing conditions. So in this, we will have two sets of conditions, one which you cannot control and the other which you can. Let's talk about the ones that you cannot control. The first, of course, that is being a woman. Being a woman, you can't help, and the risk is definitely there. The next one is your health. So now, if you have hypertension, if you have diabetes, the risk increases of developing breast cancer. So what can you do in such a case? You have to keep yourself as healthy as possible, right? Maintain your blood sugars, maintain your blood pressure, and see that it is all stayed under control. Maternal family history. This is equally important. If your mother, your masi, your nani on the mother's side, if they have had breast cancer, your risk increases. If one person has had it, the risk increases by 5%. If more than one relative has had breast cancer, the risk increases by 13.3%. So this has to be remembered. If you have family history, keep an eye out and watch yourself regularly. Then we come to the abnormal genes, the BRCA1 and 2 genes. What are these? Everybody's heard of them. Everybody's heard of Angelina Jolie and how her mother had this breast cancer, her family history was there, and she was so worried because she had the BRCA1 and she did not want, so she got herself prophylactic mastectomies, right? And that became a trend for people. Basically, that's the idea of the BRCA1 and 2 genes. So let me talk to you a little bit about these, very basic. BRCA1 and 2 genes are basically good genes. They are present in all human beings. Everybody has them, men, women, everybody, right? They actually are the genes that fight against these. I told you in the beginning, right? There are certain ways in which the body fights. One of them is the BRCA1 and 2 genes. These fight against these abnormal cells of cancer and hold them in place and destroy them and don't let them grow. Now, in case you have abnormal or mutated genes, your BRCA1 or 2 gene is abnormal, then it cannot do this fight for you. And therefore, your risk for developing breast cancer increases. That is a little higher risk, which is about 50 to 80%. How do you get this breast cancer? How do you get this gene? You can inherit it, both from your mother and from your father. So it's a 50% chance if your parents have the BRCA1 or 2 genes, the risk of getting the BRCA1 or 2 genes is 50%. Risk of getting breast cancer is not 100%. It's a risk. It increases your chance. So you have to, the idea is to remain aware. So that is about BRCA1 and 2 genes. So if you need to have counseling, then you need to do that and stuff like that. Get it checked out if you have family history, right? Now we come to factors that you can control. We just finished that, right? There are two sets in that. The external environment factors and internal environment factors. First is the hormones. When we talk about hormones, what do I mean by hormones? We all have hormones, but we do need to take them sometimes. In what conditions do we need to take them? Birth control, and in cases of PCOD. Sometimes when you're trying to have a baby also, sometimes there are hormones are given. Most important one here is the estrogen. Why is estrogen important? Because estrogen is a hormone which is predisposing to certain kinds of cancers, right? So having a high level of estrogen in your body for your life, it increases your risk of developing breast cancer, usually in the later stages of life, in the older age group. That's why they say things like, jaldi bachche paida karna, breastfeed your children, because during those times, the estrogen level in your body goes down. So it's breaking that continuation of estrogen in your body. Okay. Now, how can you help yourself? What precautions do you have to take? So very common now, find PCOD, PCOS, जिसे कहते हैं, polycystic ovarian disease. I mean, because of the stress and all that, there is, these things happen to young girls. It's okay. You need to take medication. You need to take it and take it under guidance from a doctor. What happens sometimes is you go to one doctor and these things are usually long drawn out. Nahi jama, solution nahi mila. Oh, let's go to another doctor. You go to doctor number 2, but you don't tell him what medication you took with the doctor number 1. Now, this person doesn't know. He'll start you on the next course. So you are effectively continuously taking this estrogen, which is not good for you. You have to take it under medical advice, and you should communicate this to your doctor. This is why hormones are to be controlled. Radiation. What radiation are we talking about? Nuclear radiation? No. We are talking about medical radiation. We get medical radiation. What do we do for medical x-rays? getting random x-rays. Let's get an x-ray. Oh, I'm getting a cough, a lot of cough. Let's just get an x-ray. If it's necessary, if it's indicated, if it's going to make a change to the treatment, under medical advice, only you should take the x-rays, because x-rays is radiation, which can increase the risk for developing breast cancer. Okay, so now we come to the internal environmental factors. Of course, these are the ones that you can control, right? Yes. So like I said earlier, we want to maintain our internal environment as best as possible. How do we do that? Regular exercise. It is good. It is healthy. Eat healthy food. Avoid fast foods and junk foods. Of course, it's always good to splurge once in a while. It keeps life fun and interesting. But on a regular basis, avoid alcohol, red meat consumption. These things should be reduced. And overweight. Avoid being overweight. Now here, for a minute, let's talk. Overweight, what happens is as you grow older, the estrogen level goes down in your blood, right? As you approach menopause. Now, what does the body do then? It wants to have protection, because estrogen is a good hormone. It's not a bad hormone. It's needed for women, right? It keeps your bone strength, etc. working. But when we are overweight, as we grow older, the estrogen content reduces because the ovaries stop working, right? Now, because the ovaries stop working, the estrogen has to be produced from somewhere, and the body uses fat cells. There are some hormones there which are converted into estrogen. So those fat cells convert to estrogen, and if you have more fat cells, you will get more estrogen. Right? So let's keep that weight down. Right? Understand? Okay. So now we go to the next point, which is enough. Tell us now how to find. What do we do? What is the procedure? So for this, because it is such a important topic, WHO has laid down a set of guidelines. It says first, create awareness by education, which is what we are trying to do here today. Next, doing screening programs. These should start at the age of 20. What are the screening programs? One, monthly breast self-examination. We will talk about this in detail soon. Annual clinical breast examination. You go to a doctor and get yourself examined on a regular basis once a year. Annual health checkup, so you know that you are not having any other issues such as diabetes, hypertension. These are all silent diseases. So you will never know unless you get a checkup done. And a mammogram. Mammogram is it's the standby, it's a baseline for picking up early breast cancer. But it has its side effect because it is radiation dependent. So it is not advised to all women at any time. Usually they avoid doing mammograms for pregnant and women in the childbearing age. As you grow older, after the age earliest to be 40, now they say 45 is the age at which you start doing the first mammogram. Usually it's done under doctor's advice. Once you do that mammogram, and then according to whether you have any indication or necessity, it is repeated every year or every second year. If you have family history, the doctor will advise accordingly, and that's how it's taken on. Yes, all very good. This is very nice, but tell me, what do I do? How do I do it? So first is to know that this problem can happen to you. We hear about it, हाँ उसको cancer हुआ है, उसको पिचारी को breast cancer हुआ है, हमको तो कोई नहीं फिक्र. No, first is to know that it can happen to you. Then you should know what to look for. We are talking about early signs. How do we do that? How do we know what to look for? By doing regular breast self-examination ourselves. Once you find something, God forbid, but just in case you find something that you find is not correct, is not normal for you, you need to get it investigated. And how to get it, what steps to take. And then what to take those steps, what to do next. So what do we look for? Is here we come to the most important part. What are the changes we should look for? Everybody knows about the lump, right? Lump is something that everybody knows that happens in breast cancer, and that's when we go to the doctor. Even if it's a small lump, which is a painless lump, but it's hard and not moving, you have to identify it and pick it up. This can be superficial, it can be deep in the whole area of the breast. So what is the area of the breast? Starting from under the collarbone, all the way under your breast, from the armpit, all the way to your chest bone in the middle, sternum. In this whole area, if there is any kind of lump that you pick up on a regular breast self-examination, which you do every month, you find some change, and then you pick up a lump, that is something you have to get investigated. Here, 80% of lumps that are picked up are normal, are not cancer, okay? But 20% are. Now, if you are going to follow that 20%, do you want to be that 20%? So it's better that we get it checked out. The lump can be breast, it can be in the lymph nodes as well. So armpit has to be checked as well. This is the lump, and it will start small. It will be painless. It will not hurt. And you think, what is the need? I don't need to check it out. You need to check it out. Then we come to the size of the breast. The size of the breast, normally women have equal sized breasts. But sometimes some women have naturally one side is a little bigger than the other, in which case that is normal for that person. But on a regular breast self-examination, you find one side is looking larger with no reason, with no explanation. This needs to be investigated. Just an increase in size. It's important because different breast cancers present in different ways early on. Then we come to skin changes. There's a condition called inflammatory breast cancer, which has no lump whatsoever. It will just have some slight skin changes, and that can progress rapidly. So if you are aware and you take care, you can pick it up. I'm not saying you rush to the doctor the first thing. You look at it, you see it, you find that this is not getting better over a week or over a month. If you find that there is no improvement, you go to the doctor. That's why the monthly breast self-examination is so important. Skin changes such as thickening of the skin, redness of the skin, peeling of the skin, orange peel appearance. Like I told you, if there is the lymphatics are blocked, the swelling will happen. And when that happens, dimpling will occur. There will be an odd appearance of the skin. So sometimes just a rash may be present. And if you can't find an explanation for this, if you have sometimes you change your different types of bra, the material is irritable. So you check out that. If you have some kind of talcum powder you use that's allergic to you, or some cream that you've used, you figure out all these things. If then it's still persisting, in which case you need to get it checked out. Coming to the nipple, changes in the nipple. Now, normally nipples are everted, facing outwards. Some women will have inverted nipples, that they will be pointing inwards. And that for that girl, that woman is normal. But if you have normally everted nipples, then you're finding that they're turning inwards. That's when the red flag is to be raised and you need to get it investigated. Sometimes there's a rash on the nipple, there's itching on the nipple, thickening of the nipple. Now, if it is bilateral, logic tells us there is something wrong with the clothes we are wearing or something relative, right? If it is a unilateral thing, definitely you need it investigated. We talk about discharge from the nipple. Milk discharge, white discharge, just colorless discharge is quite common. and happens, especially in cases of PCOD and stuff, where, because of the hormonal changes, it happens. But if there is a reddish discharge and it is on one side, that's when you have to get a little concerned and get it checked out. Pain. Pain is a factor which is, very common. Pain in the breasts, right? There are two types of pain. One is a cyclical pain and one is a persistent pain. Cyclical pain happens when every month, har mahine hota hai, around just before the periods. And it's all over. Both the breasts are swollen, tender, painful. This is normal. When there is pain in a specific area for a prolonged period of time, that's when you have to raise a red flag, and you don't have an explanation. Kuch boil nahi hai, kuch laga nahi hai, maar nahi laga something. Then you got to get it investigated and figure out that there might be something else here which I need to get checked out. If you want to distinguish between these two, how do you do? It's a very simple trick here, is that you have a calendar, you mark on the calendar all the days that you're getting the pain for a month. At the end of the month, look at it. If it's all the days, okay, fine. That's definitely something to worry about. If you notice that it's just before the period and stopped after, then this is something not to be worried about. So that's an easy trick. So that brings us to the next point, which is breast self-examination. How do we look for these changes? These are just a few pictures. A little graphic, and maybe people may not like it, but I'm just going through them quickly. That's a lump, swelling of the breast, lump in the armpit, discharge from the nipple, inversion of the nipple, rash on the nipple, dimpling or the orange rash of the skin, redness, and male breast changes, right? That brings us to breast self-examination. When is to be done? When do we do it? Where do we do it? And how much time does it take? It should be done around the same time every month. And if you're menstruating, having your regular periods, around the 4th, 5th day of the cycle, because by that time, the tenderness, etc. is gone. And the breasts are a little more easier to handle. It'll take about barely 10 to 20 minutes once you get the hang of it. Yeah, of course, if you're not getting periods anymore, choose a time of the year, month, the 1st or the 15th or birth date, whatever works for you, and do it on that day. It's done by a woman in the privacy of her home, right? What does it entail? There are 2 steps. The step 1 is to look, and the step 2 is to feel. When we look, there are 3 parts to this. 1 is stand up with your arms by your side and look at yourself. 2nd is with your arms raised up above your head and leaning forwards. And besides, I'm sorry, I forgot to mention, you have to move from side and to side. So you look at the front and you look at the sides of the breast, both sides, right? I'll just do this way, right? So you look on both sides. Then the 3rd is you put your arms on your shoulders and lean forwards. Why are we doing it? All these 3 methods. So this helps us. 1 is to see the size of the breast in the straight position. Besides looking at the size, the skin changes, etc. If there is any lump that is showing up on the standing position, you can look at it with the arms by the side. While you raise your hands up, you'll see if there's a lump on the other side of the breast, it will get picked up. And you turn from side to side, also the same thing. If you lean forwards, if there's a deep-seated lump, it will be picked up and come forwards. So have a look. Also, if there is any puckering, dimpling, it will get emphasized. Because if there is a deep-seated lump, it will cause, tightening, and the skin will get pulled in. Once you've done this, lie down. Lying down. So what do you do? How do you do this? If you're doing the right side, you lean a little on the left, put your right arm above your head, and using the 3 fingers of your left hand. Do not use 1 or 2. You just have to use 3 fingers, because if you use 1 or 2, the finger will go in the space and you will end up finding lumps which are not there. Don't use the tips of the fingers, again the same problem. You have to use the pads of the fingers. Then you do circular motions, small circular motions, and with 3 levels of pressure at each space. The first level will be light, then a little stronger and a little deeper, with increased pressure. So this helps you pick up a lump at any depth. The movement you start from under the collarbone, go all the way under the breast, come from the armpit all the way to the breastbone in the middle, going up to down, and don't lift your hands while you're doing this, because you might miss an area. When you come to the nipple area, you go round it and do a little compression of the nipple to check if there is any discharge. Once you're finished with the right side, lean over on the left side and do the same thing. When you're leaning, when you're sliding over to one side, try to keep the breast as flat as possible. For that, you can put a cushion under your shoulder, and that helps. So this is basically how you check yourself, right? Now, suppose you find a problem. Now, what do? Very important, because once you find a problem, like I told you, you should go first to your doctor, whoever you are most comfortable with. Your primary care physician, your family doctor. If you're comfortable with that person, please go there, right? Because you can talk to him. Important here is, when you go to your doctor, talk about the problem you have gone for, not hide it under another problem. You don't go and say, oh, I've got a cough, I've got a cold. Please also check my breast. I think I have. No. You go and you say, I have this problem. Please check it out. So then the doctor also understands that you are concerned about this issue. If the doctor handles your case the way you want it to, and you're comfortable with it, well and good. Take it to the next level. If you find that you're not comfortable, please do visit another doctor to get yourself comfortable. Finally, it is your body and your health, right? Now the doctor will investigate and he will say, kuch nahi hai, jao. And you're comfortable, go home. Don't stop doing your BSc. Continue doing it, because you need to keep a check, right? And if the problem does not solve or doesn't, reduce, you can go back again, or you can go to somebody else. Now the doctor says, yes, we have to investigate. So what will he do next? He will advise you to do a sonography. If the sonography shows something, send you to do mammography. And if the mammography is still questionable, then you do a biopsy. Only after a biopsy, you will be able to say that this is cancer and malignant or not. Without a biopsy, if there is a suspicion, you cannot say that this is not cancer. Let's talk about sonography. What is sonography? It's sound waves. They are sound waves which are, it's not painful. There is no radiation involved, and it doesn't take time. It doesn't hurt. It can, pregnant, lactating women, everybody can get it done. It is important. Why? Because it helps you distinguish between a cyst and a solid mass. You can differentiate between those two very easily on sonography. You can differentiate from the structure of the lesion or the mass, what kind it is. But it is not 100%. So a sonography, for example, will show you things like this. The first one is a simple cyst. So cyst, water, fluids will appear black on sonography. Cancer can appear anything, and if there is fat, it will appear white. So a cyst is the simplest one. A simple cyst will be well-defined margins. A fibroadenoma is a very common tumor found in women and young women, and this is a benign tumor, a benign mass. Okay, it doesn't cause, it is not cancer and never progresses to cancer. So that's what a fibroadenoma is. And that can be identified very easily on ultrasound. Cancer, like I told you, cancer cells grow anyhow. So when they grow, they don't limit themselves. They will go anyhow. And that's why the edges of a cancer will be irregular. And that is how it looks. And if there is an edge of just a small part of a tumor is showing that, it still might be cancer, which is when the doctor will send you for the next test, which will be a mammography. Mammographies, again, like I told you earlier, it's exposures to radiation, etc. It causes, it is a very, very good method to pick up microcalcification, very tiny calcification, very early signs of cancer. There will be calcifications in non-malignant tumors as well, but they have different appearances, okay? So the mammo will generally tell you how that is. It is not advised in pregnant and lactating women, and because it involves radiation. Also, it causes, you have to do compression of the breast. So usually you don't do it during the pre-menstrual period. You do it after your menses so that you're more comfortable getting it done. So that's what the microcalcifications will look like, right? Now, if the mammography shows something that is still doubtful, the doctor will advise a biopsy. Biopsy is done under ultrasound guidance. A needle is put into the tissue and wherever the lesion is, and a piece of tissue or fluid, whatever is there, is taken out and then for test. Once the test comes back, the result comes back, only then can treatment be taken. Can a doctor tell you for sure that this is cancer, and then treatment can be initiated. Treatment for breast cancer. What are the types of treatment? 4 pillars. 1, surgical, then chemotherapy, radiation therapy, and maintenance therapy. Surgical, depending on the size of the tumor, it will be just a lumpectomy or a radical mastectomy or a modified radical, depending on how big the tumor is, how far it has spread, etc. With that, usually a lymph node dissection is done. The lymph nodes in the armpit is where the breast drains. So usually they take out some lymph nodes. On the table, they will check whether the lymph nodes are infected. They pass some dye and they can make out. And if that is so, the whole lymph nodes will be taken out or as required. Each patient is individual and different. You cannot say that usko to nahi kiya tha, mujhe kyun kiya? No. Each person and each patient has a different requirement, and therefore the planning is done accordingly. Coming to chemotherapy. So chemotherapy is the drugs, which is very horrible, right? It causes a lot of disturbance because these chemotherapy drugs are the ones that kill the cancer cells. When they kill the cancer cells, they also kill normal cells. Now, the fastest growing normal cells are the skin, and the hair, and the nails, right? So that's when you get affected and disturbed, because that's a very visible way. I mean, everything else you don't have to tell people about, but when your hair goes, it's a very disturbing feeling. But what do you do? There is a lot available now for helping you with the chemo. Besides the loss of hair, etc., there are other side effects of chemotherapy, which women have, but there are lots of treatments available for them now. So the chemotherapy is better now. It's more structured, more focused. There is targeted therapy with certain cancers that can be treated, so they don't have to affect all the cells and will only be used on that certain cancer, and therefore that person will not even lose the hair. So there are different ways in which treatment can be initiated with chemotherapy. The chemotherapy sometimes is given before the cancer surgery, sometimes after. If it's a large cancer, they give it to shrink the cancer first and then they do the surgery. If it's a small cancer, they will give it after. So that again depends from patient to patient and requirement to requirement. We come to there are hormone therapy is given depending on the requirement in the patient. Some patients have the the cancer is responsive to certain hormones. So that treatment is given. Radiation is given after this is over in order to kill whatever cells that might have escaped, dormant cells there I mean. So depending again on patient to patient requirements, the radiation is given. Sometimes less, sometimes more. Maintenance therapy is given for 5 to 10 years. Again, depending on the requirements for the patients, because depending on the stage of the cancer, the type of the cancer, all of those factors have to be factored in before all these treatments have been initiated. So here, that brings me to the basis of treatment plans. It depends on the type, the stage, the sensitivity of the cancer to different hormones, and the medical history of the patient. If you are diabetic, hypertensive, vagera, that adds to your list and the treatment is modified accordingly. If your family history present, then you have to be treated accordingly. So this brings me to the end of this talk on cancer. Quick walkthrough for common breast problems, because we all have some common breast problems, which are pain. We discussed that, right? We did that in detail already. Then we have the lump. So in the lump, I would like to take you through. I discussed the cyclical pain, non-cyclical pain, correct? Now we come to the lump. So the lumps in the breast, like I already discussed, but it's just for the picture tells you a little bit more. So let's go through it. The cyst will be full of liquid, right? If it's superficial, it will feel squishy. If it is deep-seated, it will feel hard. Fibroadenomas are, like I said, benign tumors. They are not malignant and they will never become malignant. 1% might, and usually those are in the older age groups. So, and even if they do become malignant, the phylloid tumor, as it's called, it is limited to itself. It will not spread from that area. So that's fibroadenomas, and they're very classical in the sense they slip under the finger. Doctors can generally pick it up very easily, right? But when is it worrisome? When this fibroadenomas usually happen in young women, younger age group, because they are starting when the hormonal changes are taking place. This happen in the ducts, so the tubules. So that's what happens. Wahan बढ़ जाता है. If it happens in an older woman, that's when it's a worrisome, because then you want to rule out that this is just a fibroadenoma and nothing else. That's when the doctor will investigate it further. Cysts usually happen in older women. When you're coming towards menopause, that's when cysts happen. Sometimes they will appear suddenly and they might cause pain. That is very classical of a cyst. And that again is a very benign thing. It does not cause cancer. It is not cancerous. Usually it is not predisposing to cancers. So having fibroadenomas or cysts in the breast does not make you an increased risk for having breast cancer. These are not predisposing conditions to breast cancer. Fibroadenomatosis is multiple little nodular things. So you have nodular breasts, that's they're called. So those people have to be a little more careful, because you know what? Then you know that your breast has these things. Then you have to look for a dominant lump. That means something that is different from whatever is there in your breast already. And then, of course, the tumor and the abscess, which I discussed. Right? So that takes us to the next thing. Nipple changes I discussed with you, nipple discharge I discussed with you, and the skin changes. I think we went through the whole lot, and that brings me to the end of this talk. If we have the time, we can do a quiz, or if you have questions, we can take questions.
Any questions?
Hi, Ismat auntie.
Hi.
Hi. I just have hi. I just have one quick question. When you said about the cancerous cells and how they are formed. Could you just explain that a bit more? Like, means we know that some of it is genetic, some of them is external factors, but as young girls, what could we do to ensure that we are reducing our exposure to cancer cells?
Right. So that as young girls, okay, healthy eating, healthy diet, avoid excessive of fast foods, anything that is excessive. Alcohol, I mean, I'm just saying this because this is everywhere. I'm not pointing fingers to anybody here, but I know that most people in India are not on this path, but whatever. It's one of the things. Alcohol, red meat consumption, these things increase the risk. This in the Western countries, this happens. And besides that, I was thinking something of what I got a point. And this, what I said about the taking of indiscriminate use of birth control pills, of medication for getting the cycle to be proper, like in PCOD, PCOS, these kind of situations. I find that happens a lot in young girls nowadays. So it has to be addressed, very important.
So I think a healthy, balanced lifestyle with
yes. But
adequate
healthy balanced
exercise.
lifestyle, no, Alaya, what happens is, besides that, there's a lot of stress. Girls undergo a lot of stress, and then they get married, and then they have to have a baby, and then everybody's on their case. I mean, this is our India. So we have these things, and so the stress, and then the medications, all those things are. You see that percentage, 38% of younger women.
Right.
So why like that? I think this is a pretty big factor here.
Okay. Thank you.
Welcome.
Any other questions? Anybody else?
Was I understandable, or was I just going over the top?
Well, it was, I mean, we really understood it very nicely. Thank you so much, ma'am. I think we don't have